you tell us what are the links between this HIV/AIDS paradigm scam and the current coronavirus crisis? Because I believe at least they're using the same test, right? PCR test.
Yeah,
This is
there
what they
are, yeah,
start with.
they are, both are absolutely the same thing. To start with, number one, the person behind HIV/AIDS was Anthony Fauci. The person behind Corona is Anthony Fauci. He is the
Yes.
man who is the person behind both the scam or both the pandemic, whatever name you want to give. Number one, both are identified by the RC-PCR test, as you know, and the test itself is not recommended for detecting virus. So the test itself is flawed, and that is for both the things. The initial symptoms for HIV, if you remember, in 1984, they identified pneumonia, tuberculosis, lung infection. If you find any patient, then you go for PCR test. Now also it is same. If you see any patient with some kind of lung infection, some kind of cough and cold, some kind of feverish or flu symptom, then go for a PCR test. You see, the initial symptom to prepare to detect a person for the test, suitable for test for HIV test is same as for corona test. That is the lung and respiratory problem. That is also same. Now, all those things, and also the HIV is never isolated from the human being. It is never found inside the human being, as you know.
Robert
Same with
Young,
the,
Mr.
yeah,
And Luc Montagnier, the discoverers of the inventors, discoverers, I don't know how to say, they
yes,
admitted, right? They've never isolated the virus.
yeah, and the same is true for corona also. So you see, the script for HIV and the script for this corona is same. The only difference is the HIV, it was only the continent called Africa, and corona, it is the whole world,
Yes.
right? So I see a lot of similarity. It is everything same, and this is the ages of internet, and here the transfer of information happens in a moment, and that's why it got spread. Not the corona itself, but the scam of corona could get spread quite easily, and he was lucky that Anthony Fauci, that he has the internet by his time, by his side, and he used this as a tool, the mainstream media, and the social media people like you and me, when we try to expose, they just shut it by deleting those videos. As you have seen in my YouTube channel, about 24 videos already deleted on corona. So that is how, and those kind of tactics they were using in 1984 also. Just one last sentence. The At that time, the president of South Africa, who was vocal, who said officially that it is a scam, what happened to him? So he was thrown out of his presidency. So the same thing. Anybody who talk about it is silenced by some kind of method. So
And
both are same. Only it is corona. It is called HIV. That was called HIV.
I would like you to clarify because some, newspapers, they claim that they have isolated virus even in India, China, and maybe one more
Uh,
country. What do they
yeah,
mean when they isolated the virus?
they claim in India, they claim in China, and they claim in Australia.
Right.
Three countries they claim. But to qualify to be called that they have isolated the virus and it is the coronavirus itself and it is a virus which can cause pneumonia or a flu-like symptom, to qualify for that, they have to go through, as you know, Koch postulate.
Right.
But they have not tested for Koch postulate, and since they have not tested, so they cannot rightly say that, yeah, it is we have isolated. They did not pass the Koch postulate test, which normally one has to pass to say that yes, we have a virus and this virus is responsible for giving such kind of illness or such kind of symptom in a person.
Right. I understand. Thank you very much. And my next question is, so could you tell us a little bit more in detail what's wrong with this PCR test, about the cycles and the number of cycles? How do they deceive us with the test?
Yeah, you see what happens. For example, if whenever you are sick of anything, maybe a diabetes patient or a heart patient, or if you are sick with any flu, our body produces something called exosome. Right? Exosome is a extracellular material which is found inside the cells itself, human cells, and it is our own body's function. It is a normal function, and our body produces it, especially when the body is in a challenging situation, when the body is under some kind of threat, or when the body is having a challenge of immunity. At that time, for a brief period, we all produce exosome. Exosome is the size of exosome inside the cell is 500 nanometer, and the size of coronavirus, if you see the literature, 500 nanometer. Outside the cell, the size of exosome is 100 nanometer, which is the same as coronavirus. So even the receptor of exosome is same as the receptor of coronavirus. And it is the shocking thing is exosome, the picture of exosome is identical as the picture of coronavirus. You see, there is all the similarities that exosome itself can be called as coronavirus. So there is a great probability what they are detecting the not the coronavirus, they are detecting the exosome. The same as I told in my book, I wrote a book called HIV/AIDS, the greatest lie of 21st century. And there also it said that when the PCR test is testing a person for HIV, instead of identifying HIV or diagnosing HIV, what they are diagnosing is that is called HERV, human endogenous retrovirus. Conclusively, our body keep on producing some kind of internal virus based on the internal environment. And they also have a genetic material, and those genetic material can be wrongly seen as a virus. So there is great probability what your PCR test is doing, they are just identifying the exosome, and we are thinking that it is a virus which has come from outside. But I rather say it is not something which came from outside. It is just that the body has developed it, and body will get rid of it also in its own way.
And are there any patients who are healthy but still have those exosomes showing in PCR test?
Yeah, that is quite possible. You may be healthy from outside, but your immunity may be fighting certain kind of virus or certain kind of other challenges inside your body. During that time, from outside, there may not be any symptom. That means that you feel healthy, right? Right now, also, I am feeling healthy, and you may be also feeling healthy. But there is a great possibility that some kind of war might be going on inside our body, and our immunity don't want to disturb us, so we may not be knowing about it. So it is quite possible even the apparently healthy looking person may have a great amount of exosome at any point of time. It is quite natural, quite normal thing.
I've read also somewhere that they are not willing to measure, the PCR test, the material in HIV negative persons, that they refuse. They only do it for positive people because the negatives one have it too.
Yes, that is true. That is true. You see, for this PCR test, what is happening in India, the person is diagnosed with a PCR positive for coronavirus, and next day when the person went again, they are diagnosed PCR negative, right? Or the person takes a sample from the nose and from the mouth. The nose is saying positive, no, mouth is saying negative. So there are a lot of kind of the inconsistency over the PCR test. It is a random kind of thing. Anybody is randomly given positive or negative. It is not reliable because this test is not meant for diagnosis. It is only meant for research purpose, as you might be seeing on the manufacturing manual of the manufacturer. The manual itself, the first line says the regulatory status. It is for the research purpose and not for the diagnostic purpose, which, as you just said, the inventor also said that it is not for the diagnosis of a virus itself, right? So a wrong tool is used to diagnose, which is not meant for the diagnosis.
I see, right. And you also said in your presentation in Hindi that I've seen with English subtitles that only 1.2% of the world deaths are attributed to COVID-19 were actually deaths in the result of coronavirus infection, meaning 99% people died from something else. So
yes. I got the data. I'll just elaborate this thing. I got the data from the National Institute, Italy National Institute of Health. National Institute of Health of Italy, according to their data, it is just 1.2% of the people, they died actually of the coronavirus, mean at the time of their death, they were not having any other illness. So it is believed that they may be dying of coronavirus. And rest of the people at the time of death, they already having some more illness. So rather they wanted to say that they might be dying with coronavirus and they are not dying from coronavirus. Two things: dying with, maybe they are dying for from different reason. At that
Mm.
time coronavirus will be present, right? Because most of the thing you see, most of the people you see all over the world, those who are diagnosed or those who died finally, they already had two or three illness. So how can you decide that whether they died of the previous illness which they were suffering from, or they died from coronavirus? So there is a great amount of confusion. If you see the data bank of Italy, among the people they reported they died with coronavirus, among them only 12% data, 12% of the people, 12% of the people in the death certificate they wrote coronavirus is the cause of death. For rest of the 88% of the people, they are not saying that the cause of death is coronavirus. The cause of death is beyond coronavirus, something else. So nowadays you see, at least in India, if a person coughs near the hospital without taking even test, they put them in a grouping, group them in a coronavirus, and they start the treatment of coronavirus, and that is happening quite in a big scale in India. And the similar thing I have seen the report in US also. If a person is showing a flu symptom, the flu can be from many kind of virus. It can be dengue, it can be chikungunya, it can be H1N1. But now the trend is if you have a flu, they decide let it be corona. That's how. Whether it is US or whether it is India, it is the trend is same. So the reality, people may not be dying of corona, but it is the environment that they have created a panic. And anybody who is coughing, having little fever, they are labeled as a corona patient, and that is the truth.
I've heard in Japan they don't even really use the PCR test, which is full of false positives anyway. They only look at symptoms in many cases in Japan.
Yeah, in Japan also the same thing happens, right? It is also, it always happens. In the you see last year in the dengue season, anybody comes with a symptom, they are diagnosed as dengue. This now since it is a corona kind of scenario, so anybody comes with some kind of small symptoms, they are categorized. Even somebody who is fainted of some other illness is also put under the bracket of corona. You see now in India, people die only of coronavirus, nothing else. This means rest of the people they stop dying.
I see. Well, you have the numbers in India are pretty high, as I've checked today, higher than Japan or Korea.
Yeah. You see, the population of India is about 10 times or more than that as compared to Japan, right? About 15
Right.
times. So if you compare the population wise, then the number is very, very less. About 600 people died. Number one, they are saying 600 people died, but among the 600 people, those who died, they say is corona. Maybe only 50 people died of real coronavirus, and rest of the people, like Italy, they may be suffering from, as 70% of them reported by government of India, they were suffering from some other illness. So who knows whether they died of corona, whether they died of other illness, or whether they died of the treatment of coronavirus. That is the most important thing. Died not of coronavirus itself, but the treatment. You see, if you see yesterday's newspaper all over the mainstream news, now they have accepted that the anti-malarial drug, right? So this is can cause death, and this is causing death. So I believe that it may not be the virus itself, because it is a simple flu virus, as now we know, and flu cannot cause so many death. But yes, trying to give a treatment or experimental drug which is having nothing to do with virus, and that may be killing the people in reality.
I see. And even that 1.2% of people who presumably died from coronavirus, now we come to the testing point. So how did they test them? If they use PCR, we don't
Yeah,
know, right?
you don't know. Even the person, you see, if you remember the doctor in China, Dr. Lee, who was the first one to warn the world that there is some new kind of illness.
Yes,
And later in February, it was reported that he died of coronavirus itself.
true.
But before his death, at least 3 to 4 times it was diagnosed with PCR negative. It came negative, and
Yes.
maybe fourth or fifth time when they diagnosed, then it came PCR positive. So what they do, maybe in China and especially in India, they keep on testing till the time they don't get the result according to their wish, right? So it is not reliable at all. It is just something they want to prove to the world because of some kind of pre-planning. That is what I could see, what I could visualize from whatever is happening, what I'm observing from the mainstream media and from the journal reports.
I see. And one more question is like you quoted the New England Journal of Medicine that they have evidence that the mortality of COVID-19 is 0.1%.
Yeah. It is 26th of March in New England Journal of Medicine. The mortality rate of coronavirus is COVID-19 is 0.1%. But now today is 23rd of April, and that is nearly 1 month before it happened. But today we have the data from as many as 5 different studies, 5 different. Finland data we have, Germany data we have, Santa Claus, California data we have Los Angeles data. So we have about 4 or 5 more data, and all the data surprisingly are coming to the one conclusion, and that conclusion is that the mortality rate is somewhere between 0.1% to 0.18, 0.1% to 0.18. That is approximately 0.1 itself or 0.2 itself. So roughly you can say 0.1 to 0.2, and that is what is the mortality rate of any kind of influenza. It is called ILI, influenza-like illness, which is having a universal mortality rate of 0.1. So in the month of March, there was just one study, one report, but now we are sitting on 23rd April. We have about 5 reports, and all of them concluding the same thing. So it is now quite reliable that it is just a flu, nothing else.
We will provide links to those studies under our video to show
they can check. Yes, they must check. I'll share the links, and they must check.
Wonderful, great. And finally, could you tell us what is going on in India? I mean, are you going through lockdown there? Is it very?
It is a lockdown. Unfortunately, it is lockdown, and my opinion is lockdown is not needed, and lockdown cannot work in a country where the population is so big. Means about 10 or 15 Japan becomes one India. So lockdown cannot work, and the police force is very less, and it is a rural. Most of the India is rural, where people don't have internet, people don't have television, they cannot write coronavirus itself. So, and here we have been living with animals also. So if the lockdown is there, it is implemented only on humans, not on animal, right? And coronavirus can be spread through human, through air, through water, through animals also. So unfortunately, there is a lockdown, and which is many people are getting killed because of hunger, and people are getting unemployed. About 1/3 of India is going through the process. Within 1 month, they will be unemployed. So a lot of crisis is going to happen, which is already started showing also. So lockdown is there, and with limited movement, and that is true. And till what time the lockdown will be there, it is again undecided. And it seems to me it is maybe some bigger conspiracy is there behind the lockdown, because now it is already established that COVID-19 is nothing but influenza, and if it is an influenza, there is no reason of lockdown.
Right. So do you think all those lies and the role of Dr. Fauci in the White House, do you think all these lies will be exposed soon, or how are the chances?
My belief is, you see, in 2009, if you remember, there was H1N1 scam. When WHO, they announced a similar kind of pandemic, and a similar kind of scenario was created. But in 2010 PAC, Parliamentary Assembly Council of Europe, they could find out, and that it was the biggest scam at that time. They announced WHO to be a creator of a scam. So it was exposed in 2010. So now if you see the script of corona, it is exactly the same script as of H1N1 at that time. So H1N1, it took about 1 year time to get exposed. So I think that here also, since the whole world is involved and the people like you and me and other people uh, are very much vocal, so it is just few months that it will get exposed also. And also whatever they have estimated, what WHO told in the beginning, that millions of people are going to die and the mortality rate is going to be 10. Now they know it is zero point 0.1. They predicted it to be 10. It is just zero point 0.1, right? Just a fraction of what they predicted. There all the predictions are going wrong. So maybe it is a matter of few days it is going to get exposed.
Let's hope so. And are there more people like you in India? Are there many people like
India people are not vocal. Most of them are supporters, right? I have a good support from all across the country, and which includes many politicians, many bureaucrats. They started speaking when they saw all the evidences which I presented, right? So some doctors also, and but many of them they are just a supporter rather than independently coming with their own research. But yes, now if you see people, they start talking about it. They started thinking in this direction that it can be a scam, and I think that in coming days more and more people will be vocal than what it is now.
That's very good to hear. Actually, in Poland also there are big numbers of aware people, and those numbers are growing. But unfortunately, about Japan, where I'm located, it's not the case. Uh, the Japanese
Japan
people not
is Japan is lucky because in Japan, what I believe, they did not do any kind of lockdown. Still,
no.
still people are able to move, and that is a very good example Japan has created for rest of the world. That without even lockdown, they are able to survive, and that death rate is not that much in comparison to, right. Doing lockdown means people are getting killed because of hunger and because of frustration, because of depression, mental torture. Many people they committed suicide in India just because they are depressed, they are isolated. Isolation is a big disease, right? If you keep yourself isolated from rest of the world for a few days without sunlight, without fresh air, without the liberty that you can go anywhere, this can be a greatest killer, right? So Japan people are fortunate. I think they are quite intelligent, and they don't go by the trend. Rather, they are the trend creator. So I always give Japan's example in my videos that they are able to create not only herd immunity in their community, they are able to create an example for rest of the world that this lockdown is not needed. Rather, lockdown is against the humanity.
That's true. Actually, it's Japan's prime minister. This is his way of thinking, but he's being criticized by a lot of people. But owing to him, we don't have a lockdown, I think. And the law also in Japan forbids lockdown. But the mayor of Tokyo, is of different belief, and she's giving a lot of pressure to the prime minister. But we will not have a lockdown, as it seems. So people do go out. It's their own liberty. They can do what they want to do.
Yeah,
Uh,
I saw some recent videos of Japan. I'm really jealous for with the Tokyo and Japanese people that they are able to enjoy all those luxuries which the rest of the world does not. But yes, I think that world should learn from Japan, right? And I am sure that this example of Japan, people have already started talking about it, and they are going to learn. And it's good that your prime minister has taken that initiative, and I hope that our prime minister will learn from your prime minister, and that can be a stepping stone, and that can be one step forward, at least for the poor people. The rich people here, they can stay at home for many days. But the people, most of India, 70% of them, they earn every day and they eat every day. And if they don't earn, they cannot eat. And in lockdown situation, they don't know what to do and from where they to get the food. And that is really a very miserable situation for them. So I hope that the world will learn from Japan.
okay, thank you so much for today's interview. And I
Thank you.
hope to talk to you again on another topic of maybe HIV in the future, in the near future, and diabetics as well.